we can go to the next presentation. The next speaker is Professor HongYang. She's chief physician, doctoral supervisor, and postdoctoral cooperative supervisor of the first affiliated hospital, HongYang Medical University. She is also vice chair of ultrasonic branch of HongYang Medical Doctors Association, chair of intervention ultrasound branch of HongYang Medical Doctors Association, specialized also in abdominal, superficial organ, contrast enhanced ultrasound, and ultrasound intervention. It is my great pleasure to introduce the next speaker, and she will talk about the significance and the value of CEUS in thyroid disease diagnosis and treatment. Please, Professor HongYang.
And good afternoon, everyone. I'm Dr. HongYang from Nanning, Guangxi Province, China. And this afternoon, I would like to talk to you the value of CEUS in microwave ablation for thyroid nodules. In this presentation, I will begin with the introduction into the prevalence of thyroid nodules, and then I will discuss thermal ablation treatment for thyroid nodules. And after that, I would like to share our experience with the application of CEUS during microwave ablation for thyroid nodules. In the end, I will wrap it up with a brief conclusion. According to the statistics report, thyroid nodule is the second highest incident rate of thyroid disorder in China, close to 14%. This map shows global incidence rate of thyroid cancer in 2018. From the picture, we can tell China has a pretty higher incidence rates of thyroid cancer. As we know, a surgical procedure is still the most common treatment for thyroid nodules, but there are still other additional treatments which do not need surgery, including radioiodine ablation, chemoablation, thermal ablation, ART cryoablation, and irreversible electroporation. Okay, now let's look at the thermal ablation treatment for thyroid nodules. Here are several ablation techniques for thyroid nodules, including radiofrequency ablation, laser ablation, microwave ablation, and high-intensity focused ultrasound. According to the guidelines set by AACE, ACE, and AME, image-guided thermal ablation for benign thyroid nodules may effectively control nodule growth and local symptoms. But only laser or radiofrequency ablation is recommended for the treatment of solid or complex thyroid nodules. There are still other guidelines set by other countries, such as South Korea, Austria, as well as China. Among the several thermal ablation techniques, microwave ablation is the most frequently used technique in China. The mechanism of microwave ablation is similar with the radiofrequency ablation and laser ablation. Now, I would like to show you the procedure for microwave ablation for thyroid nodules. To begin, we insert the needle into the target nodules, and then The T relieves microwave energy and makes the molecules surrounding the T vibrate and increase the temperature, which makes the tissue around the T coagulative necrosis. At the same time, a cold water circulation system, which is equipped in the machine, cool the needle to avoid burning the muscles and skin. Unlike abrasion performed in other organs, such as liver, renal, or lung, the movement abrasion method is used for thyroid, especially for benign thyroid nodules. As this video shows, during the process, we insert the QT needle antenna in the bottom of the nodule. After necrosis happens, we move the needle to a new area, and from the point to point, we got abrasive light, and from line to line, we get an abrasive section. By this way, we get other additional overlap abrasive sections until the whole nodule necrosis is completed. There are potential risks that exist in this process, and due to there are several important structures around the thyroid, including large vessels, nerves, and throat, which could be damaged during the abrasion. To reduce this risk of the procedure, first of all, don't break the danger triangle, which locates here. Also, we can inject 5% glucose to make the isolation area, which will separate the thyroid and nodules from surrounding structures. For the next part, I would like to share our experience about the application of CEUS during the microwave abrasion for thyroid nodules. Contrast-enhanced ultrasound, CEUS, has overcome the limitation of CDFI and show microcirculation of tissues and tumors. Application of the second-generation contrast-enhanced agents and harmonic techniques realize the real-time CEUS images, which plays an important role in ultrasound diagnosis and interventional ultrasound. In our hospital, we use CEUS to evaluate the thyroid nodules during the whole microwave abrasion procedure. Before the abrasion, we combine CEUS and US to make the diagnosis and evaluate the vascularity of target nodules, and then guide biopsy process. During the process of abrasion, we use CEUS to evaluate the efficacy of abrasion just right after the process, and then guide the supplementary abrasion if it's needed. After abrasion, we use CEUS evaluate the recurrence of abrasive nodules. This case was a 46 years old female with a thyroid nodule located in the left lobe. The maximum diameter of the nodule was 3.5 cm, and before abrasion, we combine US and CEUS to make a diagnosis. There is not any suspected malignant characteristics on US, and CEUS show majority of the nodule iso enhancement and with several no enhancement area in the nodule. We also observed the green light hyper-enhancement around the nodule, which usually show in benign thyroid nodules. And then twice cytological examination were performed, and no enhancement area in the nodule should be avoided. And then the result of cytological examination demonstrate that was a nodular goiter. During the process of ablation, a couple minutes after ablation, gas would disappear. Then CEUS was performed to evaluate the efficacy of ablation. Necrosis and live tumor could be distinguished easily on CEUS but not on US. Just like this picture shows, hyperenhancement means there was still blood supply, and then we measure supplementary ablation guided by the CEUS until no enhancement shown in the nodule. 1 month later, we use CEUS again to evaluate the blood supply of the nodule. The two below pictures show there's no enhancement in the whole nodule. And next, I would like to share the data of our hospital with you. In 2019, a total of 6,900 cases were performed with CEUS. Among them, about 3,800 cases for liver and about 2,000 cases for thyroid. And also about 460 cases were performed by microwave ablation. Among them, about 200 cases for liver and 251 cases for thyroid. And then let's wrap it all up. According to the evidence mentioned, microwave ablation is a useful choice for patients with benign thyroid nodules. CEUS is an excellent modality to evaluate microwave ablation for thyroid nodules. However, since microwave ablation for thyroid nodules is used in clinical practice only in recent years, we still need a long-term follow-up to evaluate the efficacy of this method. And thank you all.
谢谢. Thanks a lot.
Thank you for having me.
Again, great presentation and wonderful results showed. Together with other experts, also we published some papers in which we suggested CEUS for mini-invasive treatment evaluation. And I am really convinced that in this field, CEUS has a role. Coming back to the previous one, we know that this is a controversial issue. Characterization is right now provided by TIRADS plus elasto and, in some cases, CEUS. Meanwhile, CEUS for evaluating this treatment is really useful, and I totally agree with you. I have a question from the audience for you. If we don't see any vascularization at CEUS, can be sure that microwave have been done successfully or not?
Yes, of course. And before the ablation, we use CEUS to evaluate the vascularity of the target nodules. And then we can observe the enhancement in the nodule. And then after ablation, we use CEUS to evaluate the vascularity and compare with the imaging before ablation.
Excellent.